What do you think in terms of policy? The national mental health policy gets talked about, and I do know that we put in a lot of effort. What do you think has gone wrong with the fact that it has, for all practical purposes, remained on the shelf?
You're right. It's a good document. It's a very good text. And as you know, it was substantially the basis also of the resolution adopted by the World Health Assembly in 2012.
Right.
In an ideal system, the fact that there was a good policy adopted by the government in place should automatically, without anyone's intervention, it should have led to a situation where somebody asked the question, what does this implementation of this policy require in terms of budgetary support or anything else? Those questions are not being asked because the announcement of the policy was seen entirely as an end in itself. You will recall how suddenly out of nowhere and early in October in 2014, somebody said, oh my God, 10th October is World Mental Health Day. We must do something. And then some other person said, there's a draft policy which is done and sitting somewhere. And then a third person said, yeah, let's announce it. And because that was the objective of the exercise, it was announced on 10th of October to wild applause. But then clearly there was no correct motivation in that process. So nobody asked the follow-up questions. Okay, so now what does that policy enjoin upon us to do? And can we do it? And is there the money to do it? And all the other questions about are we training enough health professionals in the mental illness area to be able to cope with this?